Today we're going to talk about exercise during the postpartum period or after you've had your baby. Returning to exercise postpartum is different for everyone. Everyone's pregnancy will go differently, everyone's postpartum journey will be different. So we will need to return to exercise at a different rate. Breathing and posture are two big things that women often lose during pregnancy. You turn into a chest breather and your posture becomes totally different to adapt for the growing baby. So I recommend to everyone, as early as 2 to 3 weeks, you want to start relearning how to breathe and reconnecting with your breath and your body to relearn posture. A physical therapist can definitely help you with that. Many factors influence how quickly it is safe to return to exercise after postpartum. The 6 to 8 week time frame when you're cleared for everything by your doctor is not a magic number, and most people can't go back to everything that they want at that 6 to 8 week time frame because they haven't built the foundation to be able to do that, and your body has just spent 9 months building a baby and changing. Some of the factors that need to be considered when you're returning to exercise include mode of delivery, whether you had a vaginal birth or a C-section, biopsychosocial factors, and that can include, are you getting any sleep? Sleep has shown that if you're not getting between 6 and 7 hours of sleep a night, your injury rate is at least 2 times higher. And I don't know any moms of young babies who are getting that much sleep. But also, do you have childcare to be able to exercise, or are you breastfeeding? Because the hormones that are still in your body will influence your ability to exercise while nursing. Also, what type of sport are you going to get back to? Your body and your pelvic floor needs to be trained differently to get back into endurance running. It needs to have more endurance than it does to get back into max lifting, which your pelvic floor would have to be able to generate max strength in order to get back into those sports. Also, another one that's big for getting back postpartum is, were you able to train during pregnancy? A lot of people might have been too sick to continuing exercise or had too much pain. And if you've had to take more time off, you'll have to get back into exercise slower during the postpartum period. There's also signs to watch for while you're getting back into exercise that you need to modify. These signs are very similar to the ones we looked for during pregnancy and include some of the pelvic pain or heaviness, any bulging in the vagina or feelings of prolapse. Also, if you have any increase in bleeding, and this is especially important in the early postpartum signs because that generally means you're doing too much, any deep abdominal ache, or any coning or doming along the linea alba, which can be signs of diastasis recti. So what I typically tell my athletes is there's a couple good rules to follow when you're returning to exercise postpartum. You want to make sure you start with low loads and low impact and slowly progress while making sure to monitor your symptoms, manage your intra-abdominal pressure, and manage fatigue. I recommend that you set up a physical therapy appointment with a women's health specialist as early as 2 to 3 weeks. We make sure to communicate with your doctor, but the earlier you can start reconnecting with your breath and your posture, the better the foundation you can build for a good postpartum recovery.